The health of everyone alive today is being threatened by a persistent fossil fuel addiction that is accelerating climate change and amplifying the harms of the simultaneous crises we face. As climate risks escalate, action to ensure a livable future can no longer be delayed. The Lancet Countdown brings together researchers from around the world to track the health impacts of climate change and the health benefits that will come with accelerated climate action. This year's report shows that all the impacts we monitor are rapidly worsening. Exposure to life-threatening extreme weather events is accelerating. Heat-related deaths among older people have increased by 68% over the past 20 years. Climate suitability for the spread of infectious diseases such as dengue and malaria is rising, and food security is being compromised, with more heat waves resulting in at least 98 million more people lacking access to adequate food than in previous decades. This is putting additional pressure on health systems as they continue to grapple with the devastation of the COVID-19 pandemic. Now, the over-reliance on fossil fuels leaves households vulnerable to the rising energy prices, and the slow adoption of renewables leaves millions exposed to dirty fuels in their homes. And while oil and gas giants are making record profits, a just, healthy transition is undercut by a lack of funding, and governments still allocate hundreds of billions of dollars to subsidizing fossil fuels. Regardless of claims and commitments, the strategies of the largest oil and gas companies would lead to emissions vastly exceeding levels compatible with a healthy future. It doesn't have to be this way. In our response to the concurrent crises, we have a new opportunity to prevent the worst climate change impacts and deliver a healthier, safer, and more equitable future. By redirecting efforts towards rapid and just climate action, people around the world could also feel immediate health benefits. Shifting away from fossil fuels could save 1.2 million lives annually from cleaner outdoor air. Greener, energy-efficient cities could benefit people's physical and mental health, and climate change adaptation could deliver more robust health systems better prepared to cope with future infectious disease outbreaks and climate shocks. The time to act is now. Decision makers must take bold actions to deliver a low-carbon, resilient future where people around the world can not only survive, but thrive. Visit the Lancet Countdown online to find the latest assessment of the state of health and climate change in your country.